Hello and welcome to Askimo TV. Today we're going to talk about foreign aid in third world countries. We have Dr. Harris here, which is an Associate Professor of Anesthesiology at the University of Utah and is also the co-founder of the International Anesthesia Education Forum. Hello, Dr. Harris.
Hello.
Hey. Dr. Harris, who funds this organization and what kind of fundraising do you conduct, if at all, which has been proven to be the most effective?
So we're entirely self-funded. The people who participate in our end of the project pay their own airfare, pay their own accommodation, their own food, et cetera, et cetera. We have toyed with the idea of becoming a registered charity and trying to solicit some charitable donations. But to be honest with you, we're all so busy. We've really never found the time and the motivation to get on with that process, which is, I understand, fairly laborious. At some point, we're going to have to, because as our projects and our group expands, we are becoming a little more popular than we had expected, and therefore spread a little more thinly. And if we could fund ourselves, we would be able to provide a little better service. But as of this moment, we have no charitable status and have done no real fundraising whatsoever.
I see. Now, people often complain that governments give so much money towards foreign aid that they end up neglecting medical problems and standards in their own countries. What would you say to respond to such a statement?
Well, I can understand how people think that. But I think like a lot of these issues, that is a misunderstanding by the population. I'm not sure statistically about every high-income country, but I know that in the United States, the government pays less than 0.5% of its GDP, of its annual budget, on foreign aid, which is really not very much. And secondly, the accusation that perhaps things are left, things are not addressed in this country or one's own home country because of that is I'm afraid patently untrue. I think the small drop in the bucket that goes to foreign aid would in no way touch the significant problem of our own country. Taking the United States, for example, we're spending 18% of our GDP on healthcare. So really, the small amount that goes to foreign aid is a drop in the bucket. And then the other aspect I think that needs to be addressed is the concept that things are left alone here to help people in different countries. Our healthcare, as much as it is criticized and decried here, is light years ahead of what is available to the average person in a low-income country. People, I don't think, understand the vast gap, the vast disparity between what is available to us, even the poor and the uninsured in America, for example, compared to those average people in sub-Saharan Africa, for example. There's a vast disparity. And so I think like a lot of these things, it's misinformation and misunderstandings that cause people to say things like that. And I think when I have explained these situations and had discussions with people, it's often they're illuminated by the actual facts. And I wish those facts were more widely spread.
Do you believe that foreign aid and global health organizations are effective in their action?
I'm going to say yes and no. I think that over the last 50 years, we've spent a vast amount of money on foreign aid and really haven't seen tremendous return on that investment. I think in the last few years, our provision of foreign aid has become more sensible. I think our management of malaria has dramatically improved. And that information is being propagated, and we're helping many countries, I hesitate to say eradicate malaria, but certainly reduce it. HIV treatment obviously is now being widely spread, thanks in no small part to PEPFAR, the group President Bush's term, I think there is starting to be a more logical, better application of foreign aid, and I think based on that we are seeing significant improvements. I think foreign aid provision has evolved, as all things do, and I think that the transition is going to benefit in the long term, and I think we're going to see mounting benefits from a new foreign aid paradigm that we're seeing now.
From what I can understand, you and your team are very dedicated to help people that are less fortunate than yourself. But at what point do we draw the line in terms of personal health and safety?
Well, that's a great question. It's a question we deal with a lot because we frequently take residents with us on our trips. And whilst I have been doing this work a long time and I'm very experienced with travel in low-income countries, our residents frequently have never been out of the country. I've fielded many concerned calls from wives of residents who are concerned, or spouses of residents who are concerned about the trip. I think you draw the line. I think this is an individual choice. I think personally, I am not going to go to a country where I'm going to have to dodge bullets. That's my line. I have many colleagues who have spent a lot of time in those countries, a lot of time working for Médecins Sans Frontières, who are incredibly brave individuals who frequently do dodge bullets. That's my line. Whereas some other folks may have a line where they're not going to risk a serious gastrointestinal infection. Everybody has their own lines, and I think I respect that. This is the kind of work and activity that really you have to be fully engaged in. This is entirely, certainly our little project is entirely voluntary, and it's crazy that anybody would do something voluntarily that they were not happy to do. And so I think these things have to be thought of beforehand. There has to be good preparation. We all go and get all our shots. We all take malaria tablets. Having had such a long history of this kind of work, we have all sorts of little tricks and tips and things to pack and things not to pack and how to do this stuff. And there's lots of books available, and we certainly make that available to the people who come on these trips with us. But I think bottom line is everybody has their own line. I think that there are plenty of projects that satisfy all those requirements and all those lines, and we should all just do what we are happy to do, because otherwise it takes away from the work.
Thank you very much, Dr. Harris, for that interesting information.
You're welcome.